I really like retirement, huh? I'm just kidding. I've been on the road for the past 3 weeks, and I have another week before heading back home. We've been traveling to Malaysia and then to Bangkok in Thailand, to Phuket, and then down here in Bali. Right now, I'm talking to you from my hotel room in Bali, and then I'm heading out to Australia tomorrow for 3 days of talks. It's been great. I love this part of the world. Try to see beautiful temples and lots of Buddha and shrines in Thailand, and then going to the little beach settings out in the islands, out in Phuket, and then now down here in Bali, seeing beautiful temples and so on. This part of the world is really amazing, and for those of you living in the US, Canada, and different parts, it's definitely worth visiting. Besides that though, I wanted to quickly share with you a case. All right, so let's sit down and quickly share with you a case from the presentation that I will have coming up in a day. So this is a case of an anterior tooth with a large post, as you can see here, that's already been retro-prepped. And what I wanted to do is I want to share with you troubleshooting in situations which you're going to be using the lid technique, and what do you do if you get voids during it. So let's start and show this retro prep has been now dried out, and I'm using this tip here to inject the sealer in there. It's a very long sealer piece, and then I follow that up with the use of the putty. As you know, it combines the cement and the putty together, and it's always a good idea to take a quick x-ray. And you can see here on the x-ray on the left that we do have some voids present in this retro filling. So the trick to address that would be to remove a little bit of the top part of the lid, and then you take a gutta percha cone, and that has ideally been coated, and then you do essentially the reverse of that hydraulic condensation that we do by placing the gutta percha cone through that massive sealer, and then push that in and place a little bit of a putty on top of it again. And here what you have is you have addressed the issue of the voids in this particular type of a case, and then you follow up with suturing the mouth, suturing the flap closed, and this is what we end up having very efficiently. It's an efficient technique for retrofilling and addressing a problem of potentially getting voids in these much larger canals. And you can see it's very quick as a method of retrofilling for our use, and I just want to share this with you as I'm going to be talking about it along many other things. All right, here we come to the end of the video from my pool here in the room. All right, so I think the surgical efficiency is a very important topic. So I hope that the lid technique, which I showcase in this video, which I developed and described back in 2008 in order to improve the efficiency of the procedure during retrofilling, was well demonstrated here. Don't forget that the lid technique was kind of inspired originally by the polyvinyl siloxane impression techniques that used to be used in pros in order to get a better kind of adaptation of the light body material. In this case, the flowable syringeable bioceramic is going to fill in the nooks and crannies as you saw in this video, and then the putty's job is to protect it during the setting time of the sealer in order for it to be kind of protected so it doesn't actually wash out. And that's really the main purpose of the putty material. And that's the lid technique, the combining of these. And actually a funny story here is that the putty material I actually wanted to develop this putty precisely for this technique. So that's the main purpose of it. When the putty came out, people were using it just like people were using MTA before, by condensing it, but that was not really the main purpose of developing the putty. I wanted to combine this light body, heavy body impression material, kind of inspired by the PROS technique, for retrofilling in order to improve the efficiency. And that's how the putty was developed back in 2008 for this particular technique. And it's actually right now the most used material for retrofilling. And I'm glad that this has been really helpful to everyone. We at Rebuild Indo have been really proud of this development. Anyway, guys, I think I'm going to get back to the swim here at this point, and I hope you found this video helpful. If you have any questions about the technique and so on, leave a comment below. I'd love to know if you are using what technique are you using for retrofilling, and if you are having better success or similar with your techniques, or any limitations that you may have. All right. Have a great one, and I'm going to be heading to Australia tomorrow for my 3-day talk, and then after that head back to Boston via Los Angeles. Going to circumnavigate in the earth here over the past month and I'm looking forward to be home finally. All right, guys, see you in the next video. Until then, stay safe and peace.